Good afternoon, everyone. Welcome. Thank you all for coming. My name is Doug Schulte, and my co-presenters today are Morgan McLean and Officer Dave Coleman. The three of us today will be giving you some really good information on educating law enforcement. Before we start, for those who are new to Huntington's and aren't really familiar with all the symptoms, I'm going to be referencing mental health in my presentation. Mental health illnesses, mental health resources, and many of the behavioral symptoms of Huntington's are similar to the symptoms of other mental illnesses. So I want to make that connection before I start. I'll also be referencing 3 HDSA resources, tools. One of them is the Law Enforcement Toolkit, and in that it has the thumb drive that's got the Huntington's Law Enforcement PowerPoint on it. This is the PowerPoint that we present to law enforcement and paramedics as well. All the information in that PowerPoint is in this guide. It's in a written format. And then we've got a key points, summation of key points. We give this as a handout to law enforcement. It's one of the 2 handouts that we give. The other handout is what you have in your hand. It's local resources that pertain to in San Diego. What we've done to cut back on some of the costs is we made black and white copies of these key points. And we actually got a printer to donate a couple hundred copies as a donation to our cause. So, the second resource is the Caregiver Law Enforcement Toolkit. And this is an excellent guide for families who have Huntington's family members that are displaying the behavioral symptoms that draw the attention of law enforcement. It's an excellent guide and gives them concrete suggestions on how to interact with law enforcement and how to deal with the different behavioral symptoms. It also has some tools to be carried with the HD patient. We have the HD profile. You put your picture on here and all your pertinent information. So if you have an encounter with law enforcement, you can give it to them and they can quickly come up to speed with what's going on with your disease. It's also got an HD profile card and a crisis template. The third resource is the medical alert bracelet. HDSA just standardized this last year. Oh, she's got one, great. And what's unique about this is that most medical alert bracelets, they have epilepsy or diabetes inscribed on the back. This one, the top pops open. There's a piece of paper in there where you can write your medical information, all the specifics about your HD as well as family contact information. So you can show it to law enforcement, and it's a tool that we need to use. Okay, so for over the last decade, I've been connected with Huntington's disease, mostly as a caregiver to my wife. My wife's now in the advanced stages, but also through support group and various fundraising events. And like many of you who are living with Huntington's, we've had our fair share of trials and tribulations. And for those of you that have been in a support group, you've heard the trials and tribulations and crises of other family members. And many of those crises involve law enforcement. Law enforcement just not understanding that the symptoms are a disease. They misinterpret the symptoms as someone being under the influence or someone that's intentionally being uncooperative. I recently talked to a woman who is a caregiver to her husband. Her husband has HD, and her husband's brother has HD, and her husband's brother committed suicide. Just prior to him passing, he wrote a letter and sent it to his ex-wife, but somehow the woman ended up with it. And the letter depicted a man who was in despair and sorrow. He was sorry for all the times he got in trouble. He was sorry for all the times he upset the family. He was sorry for pushing the family to the brink to where they had to turn their back on him. The suicide rate in Huntington's families is 3 times the national average. Not double, 3 times the national average. So my hope and my dream is that we can all work together, first responders, the medical community, volunteers, that we can come up with some new ways to support the family, come up with new resources that they can turn to avoid these desperate events. 2 years ago, after hearing the stories in support group, we started looking in society to find resources that could possibly help families with these difficult times. And a year and a half ago, I met Jamie Jarrett, my partner in crime, and she made me aware of the Huntington's PowerPoint. And once I saw that, we knew this was the ticket to go out and educate law enforcement. So we joined forces, we set up a plan, and in the last year, we've given over 30 presentations and have educated over 1,000 law enforcement and paramedics in the city of San Diego. So my goal today is to give you a brief overview of what we've done and what our strategy is, with the hopes that it'll give you some good ideas and a roadmap that you can apply to educating law enforcement in your community. San Diego is a medium-sized city. It's got a population of about 2.25 million. The 2 largest law enforcement agencies are San Diego PD and San Diego Sheriff's Department. Together, they got a combined workforce of over 4,000 sworn officers. In regard to HD, it's estimated that we have 4,000 that have Huntington's. That includes those at risk as well as those showing symptoms. And that's twice the national average. The Center of Excellence at UCSD, headed up by Dr. Corey Bloom, she treats about 150 patients. So in my opinion, the environment to educate law enforcement in San Diego is getting better every day. In the last 5 years, the number of mental health related incidents that law enforcement respond to has increased, has doubled. And 35%, and that's countywide, 35% of the calls that San Diego PD dispatchers receive in the city are mental health related. Resources such as PERT, which is a crisis intervention team, and RAP, which is a pilot program in San Diego where there are specially trained paramedics that focus on the frequent 911 users. Resources like this are emerging in metropolitan areas throughout the United States. With PERT, that stands for Psychiatric Emergency Response Team. Every county has some sort of crisis intervention team. They all have different acronyms, but they all pretty much do the same thing. In regard to law enforcement and their academies, in the earlier years, they would receive about 3 hours on mental health training. Now they're receiving 12, and it's not enough. They're relying on the crisis intervention teams to give more training, and we are incorporated in that. So in my opinion, there's a big transformation beginning to happen, one in which law enforcement is getting educated on mental health, and they're taking a less aggressive approach and adapting a more helpful, understanding approach when dealing with it. And it's all going in a very positive direction. So our first step was to assemble a team. I mentioned Jamie Jarrett. She's our lead instructor on most of our law enforcement trainings. She's lived with Huntington's. Her dad died of it when she was 12. And she's got an extreme passion to make a difference in people's lives with HD. She's also a San Diego chapter HDSA board member. The third member of our team is a friend of mine, Eric Thomas. When we got the opportunity to present to the paramedics in the city, we had the law enforcement PowerPoint, and we had to convert it to one that pertained to paramedics. So my friend Eric, he's a San Diego Fire Department engineer paramedic. He's also a SWAT paramedic. We used him to convert the law enforcement strategies to ones that pertain to the paramedic role. And Eric is also a dynamic speaker. We gave him, he was the lead on all our presentations to the paramedic. We actually gave 15 classes and educated over 600 paramedics. So, this chart outlines our strategy. Our strategy is simple. At the top, we have first responders. When I say first responders, I'm referring to law enforcement and paramedics. At the bottom, we have HD families, and in the middle, we have the resources that both parties can access. So the first step of our strategy was to present the PowerPoint to educate law enforcement, to give them the basic understanding of what HD is and an understanding of the symptoms, and then strategies for how they can deal with those symptoms when they have encounters in the field. The second part of the strategy was to find the tools and the resources that both could use to bridge that communication gap, to get the information about the HD family member, to the first responder either before or during the encounter. When that happens, the officer has the correct information, and the chances of him developing a more helpful, understanding approach is increased greatly. So our first contact was with PERT, and the reason why we wanted to contact them, because they do all the training for law enforcement and they have all the connections with law enforcement. In fact, we have a wonderful relationship with PERT. They have been the foundation of our success. In regard to the paramedics, we understood that all the paramedics in the city are required to go to a continuing education program. And so 4 times a year, they're mandated to go to these trainings to get refreshed on their ALS, their advanced life support skills, as well as the most recent changes in protocol. And so we simply sought out the CE coordinator and sat down with him, informal thing. We showed him the PowerPoint, boom, he gave us 45 minutes, and we were in. So, and on top of that, we got referrals that will keep us busy for the next year, educating other paramedic agencies in the county. So, let's talk about PERT. Stands for Psychiatric Emergency Response Team. These crisis intervention teams, like I say, are spread throughout all major counties nationwide. They consist of specially trained PERT officers, and they're teamed up with licensed mental health professionals. And together they respond to scene for law enforcement as a resource when law enforcement comes across someone having a difficult mental health issue. And so the primary purpose is to provide clinical support to law enforcement. In San Diego, they expanded the team to 41 two-person teams, and they expanded it from 23. And that's because of the demand for these mental health related incidents. So our first presentation was to the PERT Corps supervisors. And right after the presentation, the first words out of their mouth were literally, wow, we got to do something like that. The PowerPoint was really, HDSA has done a wonderful job of putting it together. And it's short and concise. It has video clips It drives home the point. I mean, you leave there and you understand Huntington's disease. The second presentation was to all the PERT clinicians, and this was key because we have the crises out in society, police are responding to it. Now they're calling in PERT. We're getting qualified people that understand Huntington's at scene, guiding law enforcement on handling the situation correctly. The second thing that PERT does is they provide education and training to law enforcement on mental and paramedics on mental health issues. So if you're a law enforcement agency in San Diego, if you want to have PERT as a resource, you need to have the officers go through a PERT training, a PERT Academy. And the PERT Academy is 3 days, 8 hours a day, where they learn about how to deal with mental health issues. And they've given us an hour of that time to present our Huntington's thing. So in this past year, we've given educated two PERT academies, over 125 officers. The other thing PERT does is they team up with other mental health resources. NAMI, the National Alliance of Mental Illness, Survivors of Suicide Loss, Recovery International, and recently, and they do training for special requests. So recently we teamed up with all those organizations, and we've given 11 classes to the Oceanside Police Department on mental health training. They're a smaller agency in San Diego. And so you can see how this relationship with PERT has really helped us spread the word. And so I really encourage you, if you're looking to educate law enforcement and you're in a fairly sized big city, you know, contact a crisis intervention team and find the people who do the training for law enforcement. The last thing PERT does is they provide collaboration between law enforcement and the mental health system of care. And they're constantly getting feedback from law enforcement, and from that feedback they adjust their policies and protocols to become a more effective resource. Okay, I talked about the resources that both law enforcement and families can tap into. The first one is the Take Me Home program. And this is an online database hosted by the Sheriff's Department, local only to San Diego, where those with disabilities can register all the specifics about their disability. Put family contact information in. They can download their symptoms, their photograph, and the nice thing about it, only law enforcement has access to it. It doesn't really help the paramedics, but our aim is really at law enforcement right now. The way law enforcement accesses this data bank is when they come across someone with a disability in the field, and they get that person's name, they contact the dispatcher. The dispatcher will download, will put the name into the system, and all that information comes out and quickly given to the law enforcement. However, this is a new program, and it only works if the families sign up for it. If the families sign up for it, don't sign up for it, then the police officers aren't going to use it. So it's critical. You know, we as family members have to search out these tools and get our family members signed up for it. Okay, the second tool is the medical alert bracelets. I already mentioned that. I've already mentioned the caregiver law enforcement toolkit. We have to use these resources. Emergency response plan. This is PERT's version of the crisis template. And here again, it's got a little bit more details than the HD crisis template, but it's a tool to carry with you that you can use when you have an interaction with law enforcement. The last thing is RAP. RAP is the Resource Access Program. And like I said before, their focus is on the frequent 911 user, the person that doesn't have health insurance, is homeless, and they try to get more appropriate resources involved in their life, so they don't have to keep accessing the more expensive 911 resources. And one of the trained paramedics listened to our paramedic presentation, and afterwards he came up, and what he offered to do was put an alert into the system so that anyone with Huntington's activated the 911 system and mentioned Huntington's disease, he would get sent the alert. He would either respond to the incident to make sure that it was handled properly, and if he wasn't on duty, he was going to follow up later. And we gave him that list of resources. You can check in with the family and make sure that they're included in the Huntington system. So this is really a resource. Oh, and also we got them in touch with the Center of Excellence, and so they got on the same page. And okay. Next, I want to talk about our presentation. The presentation, as I said, was a thumb drive with a PowerPoint on it. What we've done is we've made some changes to it to make it more effective. And it helps if the person presenting the PowerPoint has a connection with HD, because one of the things we do is we personalize it with telling real stories. And this adds another dimension of understanding. For example, our presenter, Jamie Jerick, there's a slide with behavioral symptoms, and one of the behavioral symptoms is shoplifting. So if you just mention that and go on with your presentation, law enforcement really doesn't have an understanding of what's going on inside the head of the HD family member. Jamie relates a story about her dad. Her dad would get hungry, he would go to the store, and the only thing he can think about is getting the food, taking it home, and eating. Huntington's takes away his ability to connect the dots, that he's got to pay for it first. And as a lot of you know who live with Huntington's, they often just get locked on one thought and they can't let go of it. So it's an opportunity for law enforcement to understand that these people aren't intentionally, in most cases, stealing food. The disease has taken away their ability to control their impulses. Providing solutions. At the end of the PowerPoint, we encourage law enforcement to take advantage of the Take Me Home program, to look for medical alert bracelets, to check in the pockets of the person to make sure they don't have any extra ID that explains more about their disability. And we give handouts. I've already mentioned the summation of key points. The other one is the resource. And the reason why we came up with this resource list, because we were getting feedback from officers. They would say after a presentation, I ran into a guy and he had those symptoms. And, I didn't know anything about Huntington's. We thought this was a perfect opportunity to give this resource list so that the next time he has contact with him, hopefully they'll give it to him so this person can get seen by the Center of Excellence. We can get their family members involved in the support group. We can get them on the Take Me Home program on wearing the medical alert bracelet. Training websites. Because we have such a large law enforcement workforce in San Diego, it's really impossible to get out there and give presentations to everyone. Law enforcement's really, really, really busy. But training websites, having the presentation as mandatory training on their websites is an excellent way to get at least the basic information out to them in a very quick fashion. And right now we're working with San Diego PD. They've made a commitment to do that. We're also working on getting a video of the PowerPoint, because like the Sheriff's Department is requesting that would be a better medium to put on their training website. Also, other agencies like the fire department, they have, refresher training on skills is a big deal. And on their network, they have software programs. One of them is Target Solutions. And the workforce has sent an email that they have to do this presentation. We're going to try to get these PowerPoints on that Target Solutions. And here again, it's a very efficient way to go out and spread the word on Huntington's disease. This is that resource list that you have as a handout. Understanding the 911 system. In San Diego, it's estimated that 40% of the population will ever access 911. However, if you got a Huntington's patient or a family member with Huntington's, that percentage is way up there. In fact, almost every family member that I've talked to is activated 911 at some time or other, either for a behavioral issue or for a fall. So I want to relate a story why this is important. There's a family in San Diego that had to activate 911 on 2 occasions. And they have a middle-aged son living at home displaying difficult behavioral symptoms. And they escalated to the point where they had to help get law enforcement involved. So the family member called 911. They dispatched 7 to 8 officers. 3 of them had rifles. They sent 2 canine units. And when they got on scene, they made an aggressive attack on the house. Well, it wasn't an attack. Maybe approach is a better word. And the first thing they did was they knocked out the lights of the surrounding neighbors to give them cover. And the bottom line was they traumatized everyone. Their son, the family, and the neighbors. And my guess is that the 911 caller did not give accurate information to the dispatcher. The second time they activated 911, the family was better informed. Through support group, we give updates on resources and whatnot. And this time, she told the dispatcher that her son had Huntington's. She requested the PERT team. And she explained to the dispatcher about the problem they had left when the officers came. This time they dispatched 3 officers. And when they got on scene, they met the family on the lawn, saw that they were visibly upset, and assured them that they would take care of their loved one, wouldn't hurt them. They calmly and professionally walked into the house. When they entered the room, the son saw them and remembered the last incident and charged them. They quickly restrained him without hurting him. But what they did next was key. They called for a medic response. And in San Diego, they sent a fire engine and an ambulance, a total of 6 crew members. 3 of those crew members were paramedics. A month prior, they had listened to our paramedic presentation. This is why it's important to educate paramedics as well as law enforcement. When they got at scene, en route, the call was police department at scene restraining a Huntington's patient, 5150 call. They got at scene, they met the family was visibly upset. They reassured them that they were going to take care of them. They walked in, worked as a team with law enforcement, gave the son an injection of Versed, central nervous system depressant that calmed him. They got him on the gurney, put soft restraints on him, and quickly took him to an emergency room that had a psych facility attached to it. In San Diego, there's 8 of them, and this is key. There, they kept him on a 72-hour hold. They evaluated him, and they administer medications that are going to help him deal with his behavioral symptoms. So this is how the system can work with just a little education. It was obvious that these these officers had a little bit of PERT training. And so activating 911 and knowing what to say is important. Make sure you give this dispatcher a clear picture of what's going on in your particular situation. Mention Huntington's disease. Maybe resources like RAP will respond. And if appropriate, request the specific resources that are going to help your situation. Okay, acknowledging those who aid families in crisis. This is important as it reinforces the helping and compassionate approach we as the HD community deserve. And in this last incident, we sent letters of thanks to the fire chief and to the law enforcement chief. And the letter we sent to law enforcement is the other handout you have there. You can look at it. In that first paragraph, we use this as an opportunity to educate the staff of these organizations. And we have a quick description of what Huntington's disease is, because we know it's going to go to the chief, and then it's going to work its way down the chain of command, and eventually get to the officers and the paramedics. And on the way down, everyone's going to read that Huntington's, it's a neurological disease that causes, affects movement, behavior, and cognition. The other idea we have is in San Diego, we have a big fundraiser event. It's a gala, it's a big deal. For those who go above and beyond in helping families in crisis, we're going to acknowledge them at this big event. And little pats on the back go a long way in reinforcing the kind of treatment that we want. Here's a copy of the letter. Measuring success, getting feedback from the families, and this is important for two reasons. It allows you to target the areas that need help. Either families that need resources or law enforcement that can benefit from the presentation. For example, you get feedback from a family and you're having run-ins with law enforcement because they don't understand Huntington's. Well, that's valuable information. You as a presenter can go out to that substation and give them some information and educate them. They want to know, they want to do the right thing. The other thing it does is it allows you to get information about those first responders that helped you in crisis. And then you can, write letters of commendation. Finally, some take-home points. As I mentioned before, the law enforcement PowerPoint, don't underestimate the effectiveness. Literally, every time we give them a presentation, more doors have opened up for us, and we've gotten very positive feedback. People are thanking us because they had no idea that a disease like this existed. Be patient but persistent. When you're making contact with law enforcement, especially in big cities, and those that are in administrative staff, they're very, very busy. And so oftentimes, like I've been working with San Diego PD, I'll send them reminders maybe once a month, asking them the status of, hey, what's the status of getting our presentation on the website? And they'll get back to you. Just be patient and be specific about your requests. Don't request that this PowerPoint get on websites. Make sure it's on there as mandatory training. It does no good if we don't get it out to everyone. So, in closing, law enforcement agencies are looking for opportunities to educate their officers. This Huntington's PowerPoint is actually helping them achieve that goal. I'll pass it on to Morgan and Dave. If you have any questions, we'll answer them later. And you can reach me at HDSA info. It's the generic email. Just put my name in there and they'll forward that to me.
Give me just a sec, guys. Let me get this all loaded up. And I believe we'll be off and running. So, my name is Morgan McLean from Western Pennsylvania. David Coleman from the Murraysville Police Department, which is, about 10, 15 miles east of town? So, one of the things that we do is just give you guys the perspective of what you would expect to see from a law enforcement officer. A little bit real quick about ourselves. That's you, so I'm not telling everybody about you.
Okay, I'll tell everybody about me. Hello, my name is Dave Coleman, like Morgan said here. I have 7 years in law enforcement in the Pittsburgh area. 3 of those, I've been a full-time police officer for the municipality of Murraysville. As Morgan said, it's in Westmoreland County, Pennsylvania, which is approximately 45 minutes outside of the city of Pittsburgh. So my involvement to this point with Huntington's disease has been pretty limited. Everything that I've been involved with has been through Morgan so far. I'll let him talk about, he has a fundraiser every year, but I kind of got involved in that. And recently, Morgan asked me to attend a support group meeting in Pittsburgh, and that was pretty interesting for me. It was pretty eye-opening. That was the first time that I got to see and interact with people with Huntington's disease and their families. So that was pretty beneficial for me as far as, a law enforcement perspective. And ever since then, I've just been kind of talking to Morgan about doing things with local police departments in our area, as far as going and speaking to police departments, putting together a little presentation, and trying to spread this information the best that we can. I don't know how to change slides. So
That's okay. This is going to be a much slower paced, or it's going to be a little bit of a different presentation overall. So once again, like I said, Morgan McLean, co-founder of Barbara Lee's Fast Track to a Cure for Huntington's disease. It is a fundraiser I've been doing now for this past May 1st was our 9th year running it. And overall, in those 9 years, we've raised $110,000. So thank you. One of the wonderful things is, alongside with that, I do get to do a lot of other things with the chapter. So we've done a little bit of education where the Fraternity Order of Police National Convention was actually in Pittsburgh last year, and we spoke to about 100 different officers from all around the country. Some who had actually said that they had encountered Huntington's disease before. You'd be really kind of hard-pressed to get a group of people that large actually, going, oh, hey, I actually know what this is. And then they explain their experience with it, and you kind of take a step back because the community that we're already in has a tendency to feel extremely small. So when we first got introduced to that thing, the idea of, oh, you've encountered this before. Well, tell me about your encounter. Tell me how you worked with the person, or further on down the road, did you check back in on them, or did you check back in on the families, or anything else like that? It was just very interesting to see. One of the things is San Diego versus Pittsburgh, overall size. One of the funny things is this is why you don't use Wikipedia. Because I believe, Doug, you said 2.7 million people total?
2.25.
2.25. So 2.25 million people. This is actually census from, I think, 2010 for both cities. The population for San Diego is 1.3 versus Pittsburgh, which is 320. If you take a look at the overall size of the area that the police have to actually work in, you're dealing with 7 times the size. And then residents per square mile, this one actually shocked me. Residents per square mile for San Diego was 4,000, whereas in Pittsburgh it was 5,500. And we really got the officers wrong. You said 4,000 officers, yes? Whereas I came up with 2,700.
The population figure is wrong.
Yeah, the population figure is wrong, and
That's for the county. The county is 2.25%.
the county itself. Okay, that's the city itself. The officers inside the city were 2,700 versus the 1,200 police in Pittsburgh. And then just a little jab at the bottom about the Super Bowl rings. Now, alongside with everything that we have there, Dave's going to talk a little bit about Murraysville, where he is a constable. So,
A little bit about Murraysville. As far as the small town, big town comparison, Murraysville compared to San Diego is obviously a very small town. It's a municipality, population about 26,000. Our police department consists of 21 officers, 3 of which are sergeants. We have a captain and a chief of police, and we also have 2 detectives. So looking at the numbers before, obviously 2,000 some officer police department, we're significantly smaller than that. Pennsylvania is broken up as far as police departments into a lot of municipalities and boroughs and small little areas. We don't really have a big, I know some areas have sheriff's department that takes care of everywhere in the county. Some have a county police that takes care of everything in the county. Pennsylvania, specifically eastern Pennsylvania, is broken down by boroughs, and each one of them has a small police department. As far as Murraysville, it's 37 square miles. We usually have 3 officers on per shift at any given time, at least 3 officers on. And we have 1 major road or highway that goes through Murraysville, and that's Route 22 that can pretty much take you to the other side of Pennsylvania. Next. Okay, small town advantages. I don't know how many of you live in a smaller area, municipality, borough, where you have a little police department like Murraysville. Some of the advantage of that is knowing your local officers and command staff. It is extremely easy in Murraysville and a lot of these smaller towns for you to go in and talk to the police chief. I can't imagine it would be that easy in San Diego to go and talk to the chief of the San Diego Police Department. Just because of the size, number of people, I think that would be difficult. Being able to establish a relationship with the staff as far as the officers. We only have 21 guys, so you would recognize the same faces over and over again, and you get to know people. And it's nice because you can develop a closer relationship with your community and its members, and you can have an idea of what goes on and who lives where, which is a pretty big advantage. Alerting responders to the conditions in the household, letting them know your situation. What exactly for Huntington's disease. Go ahead. Hey, this is a condition that my wife, family member, myself. This is a disease that we live with, and this is some of the things that could happen. That's, to me, extremely important as far as developing relationship with law enforcement, because the more that we know going into a situation, the better, and then we can be prepared once we actually get there and begin to handle a situation. An example of that is parents of a young male experiencing psychological problems, including anger issues, alerted the local police to underlying conditions. That was a situation that we had in Murraysville. There was a young man that was having some issues psychologically, and his family members came in and talked to us, and that really helps us know what's going on, and we can be aware in the event that there is some type of a mental crisis. Doing that and speaking with the local police, it helps you develop a plan or a strategy in the event of a mental crisis. This is who I want you to call if there's an incident. Some type of mobile crisis, a doctor, whomever, a family member, maybe a list of emergency contacts or something along that information. The information can then be passed along quickly to the officers. Especially my department, something like that happens, we all have email, and we all can go over that, and we all have an idea of what exactly is going on at any given place. We're going to talk a little bit about.
So, Dr. Andrew Tomasi, this is one of the reasons why we really got involved in my chapter with the law enforcement education side of things. Dr. Tomasi was in a area called Shadyside, which is just to the east of town, about 2 or 3 miles. It's kind of a ritzy joint, and it's right off of the Carnegie Mellon and the Pitt campuses. So from there, you always have, there's a couple of bars, there's, some nice shops, there are a couple other things there as well. Dr. Tomasi was trying to catch a cab to go back to his house and tried 3 times to actually get into a cab. When the third cab sped off, what happened was the cab company called the police. And the police showed up. They finally realized that Dr. Tomasi was not intoxicated and actually had HD. And that was at midnight. He didn't get home until almost 6 o'clock in the morning. So if you can imagine someone who's suffering from Huntington's disease dealing with that a 6-hour window of that, it's horrible.
How did they realize he had HD? Because, he didn't have a bracelet on, he didn't have his card out, it's not apparent,
Well, that's actually where an answer like that.
I'll do my best here. I'm sorry. Could you repeat the question?
Yeah, so how did they recognize that he had HD at that point? Was that through discussions with him?
I'm not. The question is how did the police recognize that he did have Huntington's disease and he wasn't under some type of drug intoxication? I'm not sure. Is the answer to that? The best guess that I can give. In a situation where you have somebody that may be under the influence of whether it's alcohol or drugs, there's different tests that we can do aside from just somebody's physical appearance or the way that they talk. For example, a PBT, which is a portable breath test that we carry in our police cars that you can have if you think that they're under the influence of alcohol. You can have somebody blow into that, and that'll give you a reading to let you know that there's no alcohol there. There's also other signs and clues of drug intoxication, and it's a little bit of investigating on the officer's part to figure out what exactly is going on. And I'm sure after speaking with him for a brief period of time, I'm not intoxicated. This is what's going on. I'm assuming that's probably how. The best way that, like I was saying a little bit earlier, as far as the communication, the best way is to just communicate that as quickly as possible. This is what's going on. That he thought that I was intoxicated. I'm not. And this is my condition. And then that way we can, the local police can do what they can to resolve that. As far as the 6-hour window there for when he was able to make it home, I'm not too sure about that either. As far as if he was.
That was after detainment.
Okay. Yeah. Morgan just said that he thinks that's after he was detained. It seems a little bit of a while to me to realize that, but again, I don't know the situation exactly for that.
It says he failed to get in the first cab. Is that because the cab didn't let him get in?
Yeah, correct. The cab drivers felt that whether it was walking or physical movements or talking, they felt that he was under the influence, and they denied it. Correct. And then the police.
He didn't fail to get into the other reason he failed to get into the cab is because the cab company wouldn't let him in.
Exactly, because the driver wouldn't.
So they, I would have thought after the first cab, said, oh, we're going to send a second cab, and we're not going to let you in either.
Pittsburgh is. With cabs, it's kind of interesting. If you go stand at any given point anywhere in the city of Pittsburgh, you'll see cabs going everywhere. And a lot of the times, how people get them is they'll call for a cab or flag them down. Or I'm assuming maybe that's possibly what happened with that. He was maybe trying to flag down cabs, which stopped, and then for whatever reason thought that he was intoxicated. And well, yes, to give them a ride possibly, but I'm sure that they also do deal with other things as far as people that get violent or angry or sick, and it may sometimes be more harmful than good to them. I'm not sure 100%. Yeah. Yeah, that's part of the investigation. Like I said, talking to individuals. The first thing you're obviously going to notice before you talk to them or smell anything is their demeanor, how they're walking, if they're stumbling, and then with a brief conversation, you can usually tell relatively quickly if what the issue is, whether it's an intoxication of some type of alcohol or drugs, or if there's. That is absolutely a question. Do you have any physical disabilities that would prevent you, as far as your balance and walking and things like that? Yeah, it's important to take everything into consideration when you're dealing with anybody, which if you think there could be an underlying issue, and take time and do a thorough investigation as to what a problem is, and look for other clues as far as an odor of alcohol or something along those lines. So. Unfortunately, there is, there will be circumstances where, things happen, and it, unfortunately, whether they end up having to wrestle with somebody or somebody gets hurt, it's unfortunate, but we're trying to do our best, I guess you could say, to make it go as smoothly as possible. So, if you have anything you want to add to?
Yeah. So here. So.
Well, our next little slide here, we were actually going to talk about I'll let Morgan talk about it here, the ID cards, Pennsylvania ID cards that can have some type of a medical alert on the ID card that can, let you know that there could be an underlying medical issue and it's not some type of intoxication.
So one of the things that I just learned about a week ago. So this is a PA ID. And obviously, you still have your organ donor here. Over here, we also can have something. It's a little American flag. It says veteran. Last week, I noticed on a driver's license in this area, there was a medical alert star, and I thought to myself, that's the weirdest thing I've ever seen. And it had just. I had to ask. I said, okay, well, what's this for? Well, I have a tendency to pass out. And I probably needed to know that. And so, thank you for at least letting me know. But still, one of those things is maybe that's something that we should all think about doing. Getting a small sticker made, put that on everybody's IDs to have that and go, hey, what's this? I see that you have a medical alert symbol here. Can you explain this? Or, maybe at that point, all of a sudden, somebody starts looking for some identification. They start looking for cards. They start looking for something that goes, hey, look, I've got HD, just to get the talk going.
She has one.
There you go.
All filled out with the information. Yeah.
So it has, on the front of the card, it has a little description. It says, I have HD, kind of what it is. On the back of the card, it has her information. And then underneath that, it has her dad's information.
Yeah, and it says I may slur, but I understand what's going on, so.
Keeps it in her wallet, right by her driver's license.
My brother-in-law,
Mhm.
one of those cards in his possession, with his caregiver with him, still never got it. Because the clerk at the motel they were trying to check into, didn't understand the card, thought they were drunk, all they were on the county police. And we got our own county police on the plus side, when they got there, they opened the card and said,
Mm-hmm.
but so depending on who's looking at that card, they'll either recognize the card or they won't recognize it.
Right.
Now, soon, where my brother-in-law lives, you know exactly what you're talking about. He's gone around to the police department and he's arrested there, and he has a condition, and that condition looks like all of these things.
Yeah, sure.
In regard to your comment there, here again, I want to bring you to the law enforcement toolkit thumb drive. Because if a card with some symptoms on it isn't really the same level of understanding as if they see that whole presentation. And that's something you can give to them. You can order these resources through the HDS website under law enforcement training. So, yeah.
Okay. And, yep.
Yes.
When you have the occasion to confront somebody or meet somebody, do you look on their wrists for medical?
Absolutely. Yeah, absolutely. Medical, yes. That was like Doug was saying. That's a really good idea as far as like bracelets, something that you can quickly see and recognize. And a lot of those, they'll have a red cross on them or something with a little bit of detail on the back of it, explaining what. We see those a lot with people with diabetes. I had an incident where somebody had a diabetic episode and they ended up stealing because they weren't in the right frame of mind, and that was quickly able to, you could tell that something wasn't right. So then you start to evaluate what's going on in the situation, talk to the person a little further, and that's when we were able to see that she had a medical ID bracelet, saw that she did have diabetes. We had medics come immediately and evaluate her, and they said, "Oh, her blood sugar is extremely low. She needs to go to the hospital." And that ended up. And we explained that to Walmart, and they were completely okay with that, and that was it. So that's great. Anything that can quickly help identify that there's what the problem could potentially be is huge, and that's one thing. So.
So that's pretty much it for our part of this. We're going to do questions.
I have a
Yes.
question which kind of relates to his talk also. The situation, the scenario that he said was that the police had been informed somebody came to the house and the guy charged him, and so they were able to take him away, basically. But frequently, the individual is able to pull themselves together for the period of time that the police is there, but it happens repeatedly. So that family members are getting verbally abused and maybe even sometimes physically abused. They call the police, and the police can't do anything because they're calm. They aren't being violent. What is the next step beyond that?
Well, what I would do in a situation like that is I'm more than likely I would hope in most situations that a family member would say, this could be a contributing factor to my husband or my wife's anger. This could be a contributing factor because they have Huntington's disease, or they have whatever issue that could be causing that. And then we can kind of explore. They could as far as asking, well, what exactly happened? Well, he was fine 2 hours ago, and 20 minutes ago he got angry and this happened, and now he's fine again. Now that you're here, then what we would do is try to help with as far as contacting any other resource, whether it's like a doctor, somebody that the family works with. We have a mobile crisis unit in Westmoreland County, and what that is similar to what Doug was saying. We can call them, and they can come out for any type of mental episode. And if that's something that they would want to look into, possibly to see if there's anything that could be an immediate danger, and see what they could do. And go from there. That's the best. There's a million different scenarios, and we just got to try to handle them, the best that we can for each individual scenario. And that's one of the.
The question was, some of those that have the thumb drive haven't been able to get them to work in their computer. And it happened to me the first time, and I flipped it upside down and put it in, and it worked. It's counterintuitive. For some reason, the way you look at it, it looks like it goes in one direction. I just flipped it over, and it works. And I almost have to remind everyone when I give them this toolkit to do that. So, and that thumb drive has a Mac version and a PC version. And it has a version without the video clips. So
there are three different types?
No. The thumb drive has all three types on there. Yeah, all on there, yeah. When you plug it in fact, after we're done, we can plug it in here and I can show you when I come up.
Yes.
Keep track of the number of times you go to a home, because like the social worker in the front row, many times the family will call and the police will come, and there's no reason to take the person to the emergency room. Or a mobile crisis will come and they pull themselves together. We know, the family knows, and you all know, it's going to just be a repetitive thing, and I keep saying do it because it builds a case.
Yes.
Eventually, they'll either go for guardianship or something.
Yes,
But you can
absolutely.
I know psych emergency does.
Yes, we do. We do incident reports for anything that we go on, any call, for whether it's a barking dog to a shooting, whatever. And our local system is called Informant. What that is a reporting system that you enter in all the basic information from your report, all those involved, and as well as a narrative about what happened and what your action plan was, what the outcome was. Another nice part of that system is we also have a section where you can put an attachment, what's called an alert to. And what that is if that name is put into our system again, if you're dealing with somebody, it can have the name highlighted with a little red exclamation point that says, hey, open this up, look, there's an underlying issue, whether it's somebody that can be combative, has a mental issue or something like that, or if there's a history, which is nice, because then we can look and see exactly what is going on with that person. And by clicking their name, what it can also do is it can pull up all the previous incident reports involving that person, and which would make it easier for obtaining making a paper trail, as far as obtaining all the copies of the police reports. And that's my department, but I can tell you that every police department really around has a system similar to that. They may not have the same one that we do, but it's all the same general idea, is that you can enter people, information, put it all together, and then that way you have all that information available. So
That has worked well for me. I always tell families to do it because I don't want to break HIPAA on anything.
Mhm.
I'll say, call this number, call this number, call this number, give these names, give these numbers. Tell them, if they don't know them yet, they will know them.
yes,
They will
yeah.
know the police and the psych emergency and mobile crisis. So
Mhm.
the family member can report that, and you take it from families. It doesn't need to be from a social worker or anyone else, right?
No, we could take it from families. Anybody who calls the police, we would speak with them, and then it would generate a police report, and then we'd have all that information documented. So, yes.
Any other questions?
Any other questions? Yes.
Basically what you're saying, if this is gonna take a while to really go throughout the United States, before you can visit everyone, all the police departments. But it's more important at this point is that you become friends with the police.
Yes.
Let them know.
Yes. Establish a relationship. Absolutely.
That would be the key point at this point.
Yeah, absolutely. If you have the advantage of talking to your local police department, absolutely do that. Get to know the officers, the command staff. Like I said, it's relatively easy in a small department. That definitely that goes a long way. So.
It sounds like there's a little difference in the audience, though. It sounds like because it almost came out in that question. It's going to take a long time for you all to go out and explain this stuff to everybody.
yeah, it is.
It's not the Huntington's Disease Society of America that's going to figure this out. It's all the folks sitting here making that presentation, going to your local police department.
Right.
It's not you all, it's us all.
Yes.
Yeah.
Because the society can't do this.
Yeah.
Staff. 50,000 police departments.
And the problem is Huntington's is a rare disease. People have no idea that someone devised this cruel disease. And so we have to go out and educate.
They're competing. I mean, there's a million topics that
Yes.
law enforcement and health officials have to understand. So we've got to, unless we're in there saying, we like an hour of your time, it ain't going to happen.
Yeah, we were actually told by the police department, we had some handouts we wanted to give them, they said, if we can do any good, unless you get onto a program to present to us at an actual meeting, they weren't even paying attention to it.
And the presentation is pretty basic. There's really nothing you have to memorize. You just read it. The video clips are really powerful. And the way the video clips are interjected in the PowerPoint, it breaks it up. And that first video clip comes on, everyone in the room is focused on it. It's a really powerful tool, effective tool.
Yes.
But as a social worker, what I'm hearing is I can take this presentation to the different metro police departments where I live in Nashville and work a public education on HD.
Well, what I recommended is to contact the people that do the law enforcement training. And in San Diego, it's the Psychiatric Emergency Response Team. That's who you want to develop a relationship with. And every county has a crisis intervention team that's got a different acronym. You're welcome.
Sorry, you can buy the presentation on the webpage?
No, they'll give it to you.
Oh, they'll give it to you. Okay, you can order it on the webpage.
Yeah. The question is about the presentation. You can order it for free. Contact Anita St. Paul or on the HDSA website, you fill out your email address and the information, they'll send it to you. The medical alert bracelet is $15. You got to buy that. And what we're doing in San Diego is trying to get a sponsor to buy them for all of the families to give to them. So, you have just a few minutes.
Yeah. It says 2:55.
5 more minutes. So, any more questions?
David,
Yes.
when you get a call,
Mm.
with regard to, you know, in something that's similar to this scenario,
Mm.
how do you, when you get there, how do you react? I'm sure it's probably different if it's violent versus non-violent, but, you know, or life-threatening versus non-life-threatening. But can you explain what's it like going to a call?
Okay. The question was, is what's it like going to a call where there could be some type of, I'm assuming, underlying issue with somebody that's having an anger problem? Is that what you mean? Like as far as, or just calls in general?
Something like that, or the doctor. I
Mhm.
mean, I'm trying to put you in that spot, but
Yeah.
you know, because I think that I don't know about anybody else who's supposed to do it. Fortunately, mine's been limited,
Mhm.
and I don't know how you guys react. What you look for, what you don't look for.
Well, it really all starts with the 911 call, whoever the complainant is and wants to have the police respond. Like Doug was saying, you know, it's as far as getting information to the 911 dispatcher, that's pretty critical as well. I know that can be tough in a stressful situation, thinking clearly and being able to relay all the information that you need to relay. But it starts with that, and then the dispatcher then passes that information along to us, and then you're on your way there, kind of thinking of a game plan. You're thinking about what what exactly the nature of the call is, whether it's a domestic. An accident. There's a million different things that we get called to handle, and you kind of start the pregame in your head what exactly you're going to do, and then once you get there, we talk to all the parties involved and try to quickly figure out what exactly is going on or what happened. That consists to a lot of the times separating parties. For example, if it's a domestic, one of the first things that we do as law enforcement is separate all the individuals involved once we arrive on scene and start speaking to everybody. So that's pretty much it. I mean, law enforcement is really kind of fly by the seat your pants kind of thing. You just got to kind of take a situation, adapt to it, and try to come to a good resolution. So yes.
On the 911 call, do you ask if there are firearms in the home?
That's usually pretty standard. Most of the instances our dispatcher will ask that for us while they have the person on the phone. They'll ask if there's any weapons, whether it's firearms, knives, whatever. They'll ask that, and then they relay that information to us immediately. So that really comes in key as far as any type of domestic or an argument or something like that. That's information they're given to us pretty quickly. So, which is important, and that's all the kind of stuff that it's good to remember, that if you are calling, is every detail that you can really provide can be helpful as far as the situation that's going on. So, any other questions? I think we're almost we're good. Yeah. Yeah. Thank you.